From the California State Senate, this is Senate Spotlight. Welcome to this segment of Senate Spotlight, where we discuss legislative priorities, policy, and other related issues with members of the California State Senate. From the state capitol here in Sacramento, I'm Brian Green, and our guest this time around on Senate Spotlight is State Senator Jim Beall, a freshman assemblyman from the 15th Senate District, Santa Clara County, San Jose, and all the surrounding hamlets. He is also the chair of the Senate Public Employees and Retirement Committee, as well as the chair of Senate Budget Subcommittee 2, dealing with resources, environmental protections, energy, and transportation. He has a full plate, and he's also a former assemblyman from the area, serving his 3 terms. Right. So we can hardly call you a freshman to politics, even though you're a freshman senator, and you obviously have a tremendous amount of background in local government. Let's look at 2013 from the perspective of all that you have done in your career, from locally and in the Assembly and now in the Senate, and what 2013 means and what it's going to mean for the people you represent and for the state of California.
Well, I'm really excited about being in the Senate. It's over 900,000 people, and a very daunting job to represent that many, and I'm going to really dive right in as a senator. I think this year, 2013, is going to be a transition year. We had all those budget cutbacks and years and years and years, and now we finally balanced the budget and we're moving ahead. So we're serving our transition year right now.
And let's talk about the budget. I mean, that's sort of the place where the legislation, from a legislative perspective, that one thing that affects everything that you are passionate about, whether it's transportation and infrastructure or children and families and housing. Mm-hmm. So for the first time in years, we finally have a fiscal plate that's at least neutral in terms of revenue and deficit. Not a lot of cuts, but still, we're still growing. We're still trying to be healthy. Give me your reaction and your take on this and what it's going to mean to those things you care about.
Well, we have a shaky foundation, no doubt about it. So we have to really focus on our strategies now. And we haven't done that for a long time. So we're going to be focusing on what the long-term way to make the state fiscally successful is. And that means successful programs, getting good education programs, balancing the budget with keeping our cost drivers like prisons from going out of hand, and having good health care for people in California.
And from your perspective on Budget Sub 2, as we call it, Budget Subcommittee 2, what will you be dealing with there? And let's talk a little bit more about that, too.
Well, that Budget Subcommittee is specifically environment and transportation, energy issues. So it's got a lot of different things. It's kind of a smorgasbord committee, a lot of all kinds of different things. Transportation, we're way behind in terms of fixing up our infrastructure. We need to really focus on developing a long-range plan. The State Transportation Commission has been working on that. They know what the deficit is, and it's billions of dollars.
Now, you came from local government. You were the youngest person on the San Jose City Council, and then the County Board of City. I won't say how long ago young was.
It was a while ago.
Yeah, that's okay. Well, so you come from local government. You've dealt with the smokers board before. Let's talk about the impact on local government. Local government, you could say, has been the victim of a lot of decisions, if that's the right word, from the state over the last few years. You mentioned realignment, education, schools, the funding for social programs and services. Is the outlook getting more positive, not only for funding, but also the autonomy that local government wants?
Well, we're starting to give local government more autonomy. We had that realignment with our correction systems last year. So we're starting to give more autonomy. We're going to look at schools and healthcare quite a bit this year. This is going to be a focus of the state legislature and the state senate. I think we want to give local government more flexibility in terms of delivery of services, but we got to have those overall rules that they have to follow so we don't waste money.
Well, the governor has, in fact, for this 2013-2014 state budget, particularly when it comes to categoricals, giving more local governments, the districts, the power to make decisions. What do you think of that?
I think it's a good idea. I think we can give them overall directions and let them develop the programs in their local communities that fit their communities best. And I think that's what they're going to plan on doing. But we can't let the eye go away from the prize. The prize is to make our healthcare system better and to reduce crime. So we have to work together with local government.
And the eyes on the prize, let's go back even to education. I know you are very interested in that nexus between education, the economy, the health of the economy, even technology, more educated workforce. Describe your passion for that and even legislatively what you want to do.
Well, I think we got to really focus on getting more money into education. That should be the top priority. We have like 1 million jobs that are going to be created in the next decade, and we don't have those people to fill those jobs in California. So let's get together and figure out what we need to do to upgrade our education system. And that has to be done. So we're going to be looking at providing more money for education and higher education specifically.
You are chair of the Public Employees Committee. I know you and your colleagues last year, along with the governor, had a pension reform package. I know you're trying to do a lot for California's public employees, but also looking at the interests of local cities and governments. Talk about your continued efforts in that area to try to make that balance between protecting the retirement of public employees, but also looking out for the fiscal stability of the state.
Well, you have to have good public employees, but you can't have abuses in terms of pensions. And I think there's been some spiking of the pensions where they got too much money going to one person that spikes their pension and getting a little greedy. I come from a family of 10 kids, and I'm kind of the medium-sized one. And Mom said, she said, if somebody takes too much, somebody doesn't get enough. And I think that applies to the pension issue. And we have to control cost. We have to look at sharing the cost of fixing the deficits in the pension systems. Mm-hmm. So that has to be done in the future. We're going to try to develop a strategy over the next year.
Okay. I know you coming from a family of 10 kids, obviously one of your passions is California's families, about the seniors, the children, underprivileged children, children with disabilities, those who are in recovery from drug abuse or drug usage, and the services that serve them or don't serve them, I guess you could say, and the rights that they have. Talk about some of your legislative successes in that area to date and what's on your agenda with that in 2013.
Well, I've been creating a mental health caucus in the state Senate. We're going to be working hard on mental health issues. I think in terms of like looking at the prison system, healthcare, and when you look at where it costs the most, you always find mental health problems. Also substance abuse. We have to directly focus on some of those issues to keep the costs down and make our society a better place to live in California. We can reduce crime by having good prevention programs.
Well, in particular, mental health, I know, is a passion for you. One area where many of the children and families are going to be affected is the implementation of the Federal Affordable Health Care Act, which goes into effect now as we speak in less than a year. Are we farther along in place with setting up a marketplace for this compared to other states? What more do we have to do? And then I also want to talk about how that will affect folks who are dealing with mental health issues.
Well, we're moving ahead with creating our mental health and our overall healthcare system in California so that people can get health care. We should have everybody covered in California. That should be our goal, maximum coverage. So we're trying to achieve as much as we can given the fiscal restraints. In terms of mental health, we should have all those health plans have full mental health parity, coverage of all the mental health conditions, including substance abuse, but especially focusing on prevention, education, and treatment when somebody needs treatment, and not shortchanging those programs. They have in the past, and it's been a disaster. Our prison populations have gone up, our social services costs have gone up. Let's try to be proactive and reduce the cost and have people prevented from having real serious mental health problems.
Well, isn't that alignment between physical health and mental health and the coverage, isn't that already part of this plan that we're working on here with affordable health care?
We'll see. We'll see if it's aligned enough. We want to have equal treatment. That's going to be the key word, having mental health programs equal to other healthcare needs. When you have diabetes and a mental health problem, it's 3 times more expensive to take care of the diabetic problem when you have that mental health problem. So let's focus on helping people get healthy in California.
Well, you have legislation that's kind of, I guess you could say, make the state law walk the walk in terms of that parity between physical health and mental health?
Yes, we have SB 22, which requires that all health plans in California have mental health parity and substance abuse treatment, and we need to have that passed into law. It's been hard to get that bill passed, and I've been working on it for 6 years now.
Mental health issues have taken center stage, especially in the last several months, especially over the debate over gun control and controlling gun violence. Some would say that nexus between gun violence and mental health is unfair. What do you say to that?
Well, I think we need to have good treatment programs in the schools. There should be counselors in all the high schools and elementary schools. There are evaluations that are needed of children that have mental health problems, emotional problems in our schools. We don't do that right now. I think we ought to have a comprehensive program. It will really save us a lot of money, and it's the right thing to do. It's morally the right thing to do. And we can reduce and eliminate a lot of problems in our society if we just focus on those kinds of prevention programs.
So you're saying diagnosis and prevention really early on in a child's educational career and growing, right?
We can have nurses in every school. We can have counselors in every school. It will save us money. And we need to focus on developing that system.
What about for adults, the implementation of Laura's Law? That's one of the things that's being talked about this year. There's only one county, Nevada County, where that Laura's Law is being implemented. Do you think that will change the face of how we treat the mentally ill if that is taken care of?
I think if we have such a thing as a Laura's Law, I think it will affect those people that there just isn't any other option. And I think some family members that have mentally ill individuals in their family would like to see that adopted in terms of a state law.
What about on the federal level? I know the president has called for a dialogue on this kind of issue and many others related to health care, obviously, with his excitement and support of the Affordable Health Care Act. What is the federal government doing to help the state, not only financially, but just in bringing these issues to the table?
Well, there's two things I would recommend. The first thing is the law passed on mental health parity at the federal level in 2008, and they have yet to issue regulations. We're waiting for those regulations so that we can have all healthcare industry conform with the federal parity law. It was actually the last law that Ted Kennedy had passed in his name, and it's sort of his legacy. The second thing I would recommend is we did a great job in getting Prop 63 passed in California a few years ago. Senator Steinberg has gone to President Obama and said, why don't you copy what we did in California and have a Prop 63 program nationwide? And I think having a Mental Health Service Act of the United States would be a good model for the country.
You've partnered with Senator Steinberg on some of his legislation, not only dealing with mental health issues, but also with autism and other types of issues. Explain some of that.
Well, we have the same basic philosophy that getting to problems early is going to save money, but it's also the right thing to do for the families. And having a child in my own family that's special needs, I know that we really should focus on helping those families that have autistic kids, and they should not have their children's health care turned down by health insurance. So we passed SB 946 in the last session to require insurance to cover autism as a healthcare need.
Great. As we drive away from this discussion here for a transition to talk about transportation, how's that? Let's talk about transportation. I know that's one of your passions. We're dealing with infrastructure that still needs to be repaired. In the Bay Area, we have a bridge that's going to be coming to life here by the end of the year.
Yeah,
a lot
finally.
of things, finally, yes. So there's a lot of things that need to be done, not to mention high-speed rail and a few other things, but just in sort of a blue sky discussion. In your district and here in the state, from your purview, what do you think needs still to be done?
Well, we have a lot of traffic congestion, and let's solve it. The traffic congestion, a lot of it can be solved by finishing the projects that are on the books, number one, and also building transit systems. BART to San Jose is very important for my constituencies, and we need to expand transit. Transit has been neglected in California, in my opinion. It is a real solution to solving our congestion problems and for the economy in California. Cheap, efficient way of getting people around is very important. Gas prices aren't getting smaller, they're getting larger. So let's look at transit as an option more than we have in the past. I think it has to be promoted.
Just as a final question here, transportation, social service issues, mental health issues, healthcare issues, it's all an important thing, so much work to be done. Where are we, going back to that first question I asked you with your crystal ball into the future, not only for 2013 but other years, is the money even there to do it? Is the will there to balance the scales when it comes to the needs of California's infrastructure and its people?
I think we got to stop being ideological and start being more about making government work better. And I think we got to look at what's the right thing to do, what's the moral thing to do, and what's the most cost-effective thing to do. and we know a lot of the answers already. We just have to implement them. I think we're way behind all the studies, all the testimony that we received in terms of what's the right thing to do. We know that if you let something get deteriorated on a street, it costs 7 times as much to repair that road once it falls apart. So why let the place fall apart? Let's keep up the maintenance. Let's do prevention programs, and let's save the taxpayers a lot of money.
Is there the political will to do that on both sides of the aisle?
I think we have a lot of new legislators. I think there's new ideas. The governor seems to be willing to look at creating an environment to do this, and I think we're on our way now in California.
Great. Well, Senator, there's so much to talk about. Let's have you back to do this again as some of your legislation sort of takes root and the debate comes up. We'll talk about some of the issues and have you back again another time.
Yeah, thanks.
Thank you. Senator Jim Beall from the 15th Senate District, representing Santa Clara County and San Jose and those areas around that. Thank you for joining us, sir. And that is it for this edition of Senate Spotlight. We invite you to join us next time around as we discuss important legislative issues and policies with the newsmakers and newsbreakers of the California State Senate. From the state capitol in Sacramento, I'm Brian Green. Thanks for watching. Thanks for watching Senate Spotlight.